This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm T.G. LaFredo. According to the CDC, as of December 30th, 2025, a total of 2,065 confirmed measles cases were reported in the United States. Among those, 2,041 measles cases were reported by 44 jurisdictions. These jurisdictions span the country, from Florida to Alaska, New York to Hawaii, and yes, Arizona and Nevada as well. This week on the program, my guest is Dr. Ryan Swapp. He's a board-certified pathologist and the medical director of the Pathology Suite at KRMC. We're talking about measles, vaccination, and media literacy. Hi, Dr. Swapp. Welcome back.
Happy to be here. Glad to talk again.
Are you concerned about measles making it here to KRMC? It seems to me it's a matter of time.
You know, it probably is a matter of time. We're seeing it with increasing frequency just in the country.
Yeah.
I don't know that I'm aware that we've seen a case here, but there have been cases close by. I'm sure we're going to see it at some point.
Yeah. What does that look like?
I mean, we can talk just a little bit about measles and what it looks like, because I've never seen a live case, to be honest with you, because we assumed that it was kind of like smallpox, that it was basically eradicated.
That's a better place to start. What is measles?
Yeah. So measles is a virus, and it's the way that it manifests itself most commonly is just with this really red rash, and when you're a med student and you're talking about measles, it's the 3 C's. So it's cough, it's coryza,
which is
a runny nose, and conjunctivitis. So those are the 3 things, and it's usually accompanied with high fevers. It's really, really contagious. It's like more contagious than, it's like one of the most contagious. In contrast with rubella, which is German measles, it doesn't cause deformities in utero the way that rubella does.
Okay.
But it can cause severe sickness. It can cause death.
Is it right that kids are usually most vulnerable to measles?
Yeah, I mean, anytime the people who are most vulnerable are people at either end of life, right? It's closer to the end of life or at the beginning. And that usually has to do with immune system either not being totally ramped up or starting to kind of lose some of its efficacy at the end. So anybody who's immunocompromised in any way at the beginning of life or end of life, but yeah, kids are often who we worry about the most. I think we should talk about just the MMR vaccine in general.
We should.
Yes.
It won't be the first time. It won't be the last.
Yeah. So vaccines are something that we talk about as a society, at least in America, quite a bit. And that's been going back for a couple of decades now. And there were some allegations around the MMR vaccine that were linked with autism. The study that was making that claim turned out to not be based on good data. So people had to recant the assertions that they were making. And this just left us with a lot of confusion, because at the same time that autism was making, it was becoming more and more prevalent. I mean, anybody who's been around for the last 20 years or so, I mean, you know someone well, or you know someone in your family, or someone, there's just, all these, this neurodivergence that is, I think, undeniable. And then whether this is linked with vaccines has just been kind of a question that we've been grappling with. For someone who looks at the longer term of human health and the advancements we've made within medicine, I mean, in terms of public health, vaccines and clean water are probably the biggest things that have changed the lifespan for human beings. Are there some side effects with vaccines? Yeah, there are known side effects with vaccines, but we're in a much better place because of vaccines.
Yeah, and to be clear, at this point, there have been no credible links between the MMR vaccine and autism.
That's right, yeah. There have been no credible links. And so that theory has been kind of debunked. But, it's just a funny thing in society. It feels to me like truth in general kind of has just been eroded, and we're just left with this big,
pretty malleable,
confusing milieu that we just swim in all the time. And so, yeah, I would want to be clear that there have been no credible links that I'm aware of between the MMR vaccine or other vaccines and autism.
Yeah. But the social repercussions of that study, also undeniable.
Undeniable. Yeah, there's no question. I mean, we can speculate a little bit why that is, but I think that as human beings, we're unaccustomed to living without pestilence and disease. And it's just been something evolutionarily that we're like trying to wrap our heads around. In the absence of challenges and problems, we sometimes create them ourselves, right? Possibly. And so...
Oh, yeah, boy. Am I allowed to quote Nietzsche?
Yes, you are.
As I recall, the quote was, "In peaceful times, the warlike man sets upon himself."
So true. Yeah. I think there's definitely some of that going on. But in any case, yeah, we are seeing a resurgence of measles. It is something to worry about. And can we talk about herd immunity for a second?
Yeah, please. What is herd immunity?
So herd immunity is interesting and I think maybe not super well understood. And so what herd immunity does, let's just try this analogy out and see how this works. But I think that it's something kind of like electrical conductivity in a way. So think about a closed container with a whole bunch of ping pong balls that are just kind of bouncing around in there, right? They're all touching each other. And right now, they're all the same color. Now, that represents a perfectly... So I'm kind of mixing metaphors here, but let's just go with a ping pong metaphor for a second.
Sure.
So if everybody is immune to measles or whatever, what have you, nobody's contracting it, nobody's passing it on, nothing's happening. As soon as certain individuals become susceptible to the disease when they're not vaccinated, then all of a sudden there's a chance for these individuals to touch one another in that ping pong ball milieu. So if you have two orange ping pong balls, they're bouncing around. At some point, they are going to talk to each other or touch each other. But as you get more ping pong balls, it's not that the risk grows in a linear manner. It's that it grows in a logarithmic manner. So, and that's really the scary thing about this. It's that we're seeing them at all means that there are many more other people who are unvaccinated and susceptible to the disease. And of those, a certain number, a disproportionately higher number, because this is a recent trend, are going to be kids who are going to be at most danger for complications and death. So the herd immunity, it's not a problem until it's a problem. And then it's a real problem because when you're seeing the disease out in the community, it means that you've got a lot of people out there who are not vaccinated, and it's the potential for a much bigger issue. Does that make sense?
It does make sense. Yeah. It's a good way to visualize it. And I think you have an interesting vantage point on it because you're a pathologist. You are not spending your days trying to convince people to get vaccinated, but you are seeing, in many cases, you're seeing the repercussions of people not getting vaccinated, right? When certain things come your way for testing. Is that fair?
I think so. Yeah. I mean, I don't see patients typically. And part of what we do is, as the medical directors of the laboratory, is to, look at what tests are being ordered, what things are coming up. And you notice, even if you're not doing a scientific study, you can just see anecdotally that, all of a sudden certain things are popping up. A good example of this is just the flu every year. And we kind of track this, but not in the same way that the county health department tracks it. But actually, probably in a more similar way than not. And so you can see when certain strains of flu are coming on. And in the same way you see, things like measles popping up. Again, we haven't seen it here yet, but it's in neighboring communities. It's close by, and there's no doubt that a lot of people are not vaccinated and potentially susceptible.
Will you have the mechanisms in place to test and to find these things out when they do show up?
Yeah, we have a relationship with the Mayo Clinic reference laboratory, and so we send our specimens there. So it's the test for that, it's a PCR test. That's a polymerase chain reaction test. And what that basically does is it takes DNA, or certain viruses are RNA-only viruses. So either DNA or RNA, and then A PCR test basically amplifies that genetic material, and it's very sensitive. It's super, super sensitive. So that means if it's there, it will have a positive result. And so it's a throat swab, it's a PCR test, and it's very sensitive, like I say. And we would be able to turn that around in a few days. But honestly, just the symptoms of measles are pretty unmistakable. And so with pretty high confidence, if you see that rash, a very high fever, and you've got the 3 C's, the cough, the runny nose, and the red eyes, and often you'll know somebody who had something like that because it's super infectious. So even before you get the symptoms, you are potentially able to pass that disease on 4 days before your symptoms set in, and then 4 days after. So, the virus is just kind of like dripping out of you for many days.
If you're just joining us, this is Focus on Your Health. I'm TG LaFredo, and this week on the program, my guest is Dr. Ryan Swapp. He is a pathologist and the medical director of the Pathology Suite here at KRMC, and we're talking about measles. Dr. Swapp, there was a point not too long ago where measles was considered effectively eliminated from the United States.
Yeah, we thought it was gone, the same way that we thought that smallpox or polio or other things, that just don't show up in the United States or even in most parts of the world, we thought it was essentially gone. Mm-hmm. And here it is. We're talking about it.
I feel like, these things were effectively eliminated, and mm-hmm. now they're back. Yeah. Not so much by popular demand, but they're back, right? And so we said that it's the topic is politicized, and that makes it a minefield. Mm-hmm. And moralizing is never a good way to get through to people. When you find yourself in these conversations or on the radio, for example, how do you navigate that? The knowledge that you want to convey versus trying to stay away from weird partisan arguments, right? You're a doctor. That's not what you signed up for.
I was literally I've been thinking about this since, you reached out to me. How do we even talk about this? Mm-hmm. And, it's really a problem that we can't talk about these things in terms of, in a way that doesn't evoke emotion. And I'm not convinced, but I think what I've observed in the last decade or so has been kind of the erosion of public trust in professionals, in institutions, and at some point I'd really like to see the pendulum swing back the other way and get back to looking at data in an unemotional way and saying, these are the reasons why this makes sense for us as a whole. And
what are the keys to making that happen?
I don't know. I guess we have to feel enough pain, first to be able to say, what we're doing isn't working. I think one way to think about this is the flu shot. And I think about this now because my parents live in the community. They live just up the street from us. And so it's a more personal thing. And I have a bunch of kids, right? So my kids are always bringing stuff home. We are like, the epidemiology station for Mojave County. And
your immune system is bulletproof at this point.
I don't know. but yeah, we bring it all home. And one of the, when you get a flu shot, you're doing it for yourself, but actually, if you work in the hospital, you're required to. And the reason is not because the hospital is so concerned about you getting the flu and missing work or whatever. The problem is you're going to get the flu and you're going to be sick, but there are going to be some days when you're passing the flu on to the patients who can die of it, and many people die of the flu every year. And so we have to get to a place where we do things again for community. We do things that are larger than ourselves. I guess maybe I am moralizing here a little bit.
It's hard,
but maybe those are two separate things, to be honest with you. Just to be able to, one, talk about data and come to conclusions is one thing. And then the second thing is making decisions and choices.
Well, I think so.
that affect other people in a positive way.
Altruism is one side of it, right? But another one, I think, is a certain amount of science literacy, media literacy.
Yeah. Well, I was recently reading Peter Attia's book. It's called Outlive, and he's basically one of these doctors that are concerned with longevity.
Okay.
He has a very popular podcast, and he, by training, was a general surgeon at Hopkins. He talked a lot about, there's a section about nutrition in his book, and I think that this is kind of emblematic of just science in general and being scientific literacy among the public. He really kind of takes the media to task about these retrospective, studies that don't show a lot of difference and then making much ado basically about nothing.
Mm-hmm. Yeah.
Right. So
to mine a study for a headline, right?
So these, sometimes epidemiologic studies have been really helpful for us in the past. For example, smoking. That's something that changes your risk of lung disease and bladder cancer and many other things, many 10 times fold, 30 times. I don't know exactly what it is, but it's not like 1.5 times risk. And so that's where those epidemiologic studies are really powerful.
Right.
And everybody's doing the epidemiologic studies because they're cheap and they're easy to do. They're not like a double-blinded, randomized controlled trial. Those are hard to do. They're expensive to do, and nobody wants to do those. And some of them are feasibly just not possible.
They require ethics boards, right?
And not only that, they require decades of time and compliance and a certain size of the population, and all that takes time and money. And sometimes we just don't have the time and money to answer those questions.
Okay.
So I guess my point is that, again, we live in this milieu of confusion, and then you hear, somebody make a claim that if you eat hazelnuts 3 times a week, you're going to live 10 more years.
That's great.
Right?
Sign me up.
And those are just ridiculous claims. And then you just think, well, all this stuff is stupid anyway. Why do we even listen to doctors and scientists? Because none of that makes sense.
Yeah.
Right?
So part of the blame goes toward doctors who sign up to be pitchmen is that?
Totally.
Yeah.
Yeah. That's absolutely true that, some doctors kind of sell out to,
Yeah. Hawk is the word. Yeah.
Hawk a certain wear or something. Yeah. And so what you see is kind of the rise of podcasts and
This week's episode is brought to you by Dr. Swapp's Miracle Cure-All Herbal Supplement.
Yeah. So I don't know. Maybe doctors haven't done a good job of really protecting their profession either. Maybe we haven't done a good job of communicating.
I asked you what the way forward is, and you've laid out a very clear.
I'm really good about creating ambiguity.
It's so hard.
Yeah.
It is so hard. And I think that speaks to the extent of the problem.
Well, the path forward really, in my eyes, just looking at the data is just, getting vaccinated, just getting vaccinated because I'm complicating this. But in this case, it's really not that complicated. There are side effects. Yeah, if you want to delay the timetable of, getting the MMR vaccine for your child, okay, that's better than not getting it at all.
During a time of outbreaks, you may not want to delay it.
Right. It's not a problem until it's a big problem. And then I think that we've gone away from science, really. We've gone away from science, and I'd like to go back there. I'd like to move away from individualism as much and move more towards institutionalism.
You communist.
No, it's not that. Look, I believe in the free market.
You're a free market guy. Yeah.
There's a reason why it takes years and years of study to, become and do something. And I think that there should be a certain respect for that.
Well, we should wrap up the conversation on measles, and we've covered the best way to protect your kids in particular. is to get the MMR vaccine. Measles is highly contagious. So is there something else that we should know? Or is it basically like, get vaccinated?
I mean, it's get vaccinated. It's take care of your own health.
Yeah,
right?
The other basic elements of germ theory.
Yeah. And then the other piece that is like so important that I've just, I read a book about recently that I've completely undervalued for so long is just sleep. I don't know how this kind of slipped by me. Maybe because I was not sleeping for so long.
Maybe it was residency. Perhaps it was in that time frame.
But I mean, sleep is just so important for us in so many ways. I mean, just in terms of your immune system, it's a huge deal. But also in terms of like your ability to prevent cancer.
And mental health, and
mental health.
Forestall dementia and other
all of those
cognitive
things.
problems. Yeah.
And metabolic disease and like pretty much all of the things that we worry about.
The secret superpower.
Yeah, it really is. Like, and sleeping has become kind of a lost art. So, sleep, honestly. So, I mean, aside from vaccinations, like, getting good sleep and exercising. And that sounds trite, but it's pretty hard for all of us to get good sleep and exercise. I don't know many people who are like doing it super well.
Wake me when science is back at a higher value. Can you do that for me?
Right.
I'll be ready.
Yeah. Sounds good.
Well, Dr. Swapp, in the moment that we have left, we talked about measles. We talked about media literacy. For listeners with additional questions, what resources could you recommend?
I've talked about institutions a fair bit, and, the CDC has a lot of really good data. Also, I would really point you towards guidelines that academies of physicians, such as the American Academy of Pediatrics, they have teams of people who are looking at data and metadata and coming up with, they really test things before they go out and say things. And they're not 100% perfect. Sometimes they change their minds on things, but they do it slowly and deliberately after looking at a lot of data. So I put a lot of stock in that. Honestly, talking to healthcare professionals is usually also a pretty safe place to be, and specifically those who are board certified. Those degrees really matter. It's really, if I can just talk about this for one brief second.
Yeah.
So, when you're a doctor, you go to med school. It's hard to get into med school. You get into med school, and then you go to a residency program to further specialize. After you complete your residency program, the only other credential that you have is board certification. And so it's really the gold standard for doctors. If somebody's not board certified, then to me, it's a problem.
Can you practice without board certification?
You can. So that's
for a while. Can you do it?
So licensure is different than board certification, which is interesting. A license is something you get from the state that you practice in.
Okay.
It does not require board certification.
Okay.
It just requires that you have trained in that residency program, or you don't even have to do a residency. In many cases, you just have to do an intern year to be licensed. And so that's a big difference. So I would just always look for board certification with your physician. But that's me. I'm just a traditionalist. Look at me. I like institutions and measures of competency and stuff like that.
Kind of important.
Yeah, I think so.
That is Dr. Ryan Swapp. He is institutionalized and he's certified. And he's a pathologist and the medical director of pathology here at KRMC. And Dr. Swapp, thank you so much for your time and your expertise.
I really appreciate it. Thank you.
And that is another edition of Focus on Your Health. I'm TG LaFredo. Thanks for listening. We'll catch you next time.